You came to us, you were having these obstructions, right, and pain and having
Yes.
trouble eating. And
Yep.
you have a cancer that's blocking the intestines, correct?
Yes.
And we
Yes.
found these cancers that were growing and kind of strangling the intestines, right?
Yes.
And how many treatments have you had now?
I've had 6, and I have no more pelvic pain, and it was to the point where I could hardly get up off a chair without being in complete agony. That's all gone.
And you were also having trouble eating, right?
I couldn't eat almost anything.
So tell me what's
And that went on
happened.
for a month, and I went back to the surgeons I had, and they basically said, well, we don't really see anything. And then in an hour and a half, an oncologist said that I had 2 months, 6 months to go.
And what did they offer you?
Chemo.
Kemosabe.
That's right.
But you had chemo before, right?
No.
No chemo. But you
I
didn't.
always refused.
So you never wanted chemo. And so tell us, what does it feel like to get radiosurgery?
It doesn't feel like anything. The staff is wonderful. You just lay down on the bed and on the stretcher, I guess, and this famous little special bed, and you feel nothing, very relaxed.
And how long does the
And
treatment take you?
It takes about 20 minutes, and then I go out down to the street and take the subway home.
So you're feeling perfectly fine?
I'm feeling so much better, I cannot tell you. This is the best decision I've probably ever made in my life.
And have we paid you for this endorsement?
No.
No? You haven't got your $20?
I'm a medical transcriptionist, so I understand all of this. And I felt so hopeless. I said, nobody's ever going to listen to me. Then I tuned into the show. A friend of mine told me about it.
Okay, so what's your advice to other people who have cancers?
I've already recommended 2 people to you that have had extensive chemo and it hasn't done them any good.
Okay. And anything negative about our staff, or any things you'd say that we could make it better?
Actually, no. I mean, it's and I never have anything good to say about the medical profession.
Hey, that's like me.
Yes.
Like birds of a feather flock together.
So, anyway, no, the staff is wonderful. Their attitude is great. You know, I'm legally blind, and some people are very, silly about it. They have to get used to you. They came right up to me. They let me take their arm, take me every place. No problem. I don't feel like I'm imposing on anybody's time. It's just an amazing situation, the way they all should be.
Yeah, and so Carrie and Sherelle are treating you, right?
Yes, and
You have Marilyn,
Iris,
the
I
nurse,
think.
Iris and Marilyn, yeah, the whole staff there, yeah. Well, it's great that you're doing
Wonderful.
great. I'm glad that you can convey your feelings and let other people know what it's like to actually get treated, because sometimes people are afraid of the unknown.
Sure.
Yes.
So,
Absolutely.
were you afraid of the unknown before you came to us?
No, because I've been a medical transcriptionist for 40 years, but I was afraid of the known, and that's what was going to be offered to me. And the way it would, like you tell a person everything that can be done and everything to expect. The oncologist that came into my room when I was overnight at the hospital for dehydration because I couldn't eat said to me, "This is what you have to do. This is what will happen, and if you don't, that's it. And if you do, that's it. But it might be a little longer."
Well, we think people should have choices, and that's what we give them. We give them
Yes.
choices and
Absolutely.
let the patients choose. All right, well, God bless you. I hope you stay warm today. There's supposed to be a big snowstorm coming, I guess. I don't know.
Well, got to walk those beagles.
Yeah. Well, you got to have
Bundle
a
up, Eileen. Make sure you
She
bundle
loves
up.
her beagles. She wants to live longer than her beagles. I think you should live longer than your dog's grandchildren.
I hope so. If I had one wish in the world, that's what it would be.
All right. Well, I wish that you have good health and great holidays, and we'll see you next week.
See you Monday.
Thanks,
All right,
Eileen.
God bless you. Bye-bye. And we have another call on the line, Dr. Eisen, who's our Spanish specialist. Good morning, Dr. Eisen.
Good morning, Dr. Lederman. How are you?
Fine, thanks. Dr. Eisen is a Argentinian-born, South American-trained radiation oncologist whose specialty is taking care of the cancer patient in Spanish, in their own language. So how are you today?
I'm doing good, and I'm trying to learn from you, actually, because on my Spanish program on the radio station, I'm kind of learning the way that you are doing for the English speaking. And actually, I spoke about prostate cancer. I'm starting very slowly. And I got a phone call from a patient, 75-year-old, with prostate cancer who's coming to see me on Monday for a second consultation with me, first consultation with me as a option, and he was offered surgery. Only surgery.
In the old days, before everyone was so hungry, 70 was a cutoff for surgery for prostate cancer because the mortality, which means the death rate, goes up with age. Now, with us, we've treated young people lower than 40 with radiation, radiosurgery, because we know the success rate is higher than with surgery. But it's surprising and shocking they're going to take a 75-year-old man because the mortality and complication rates go up greatly. What is his PSA and Gleason score? Do you know that?
That's amazing. I mean, he was told that he has localized prostate cancer. He was scheduled for surgery on Friday. He's coming to see me on Monday, and he didn't know exactly his stage. He was not informed exactly about his Gleason or his PSA. And the other shocking, this is a well-educated person who went...
It doesn't have to do with the educated patient. It has to do with the doctors who don't give the patient their documents. The patient should have a document showing the pathology, the biopsy, the Gleason score, which is how the cancer looks under the microscope. The patient should have a copy of the PSA, which is the blood test. And the patients that come to us have those copies. And they can go and show their friends and family, look, this is what I have, and these are the options, and I'm going to choose this treatment because XYZ. And we can tell you just for a typical person, let's just say a typical person, and I have the date in front of me, and people who want to call in to get our prostate book, it's available at no charge. But let's just say the typical man in New York has a PSA 4 to 10, which is the blood test, 4 to 10. If he went to have surgery in the best hands in New York, the success rate is 76%. If they came to us, the chance of cancer-free survival is 90%, 18% better. Wow. There's 200,000 men a year with prostate cancer. If everyone came to us rather than the surgeon, that would be 36,000 lives saved. So this man needs to know that just removing the prostate doesn't mean you're home free. It actually is the beginning of chaos. And I have a paper here from a big cancer hospital nearby, and the director of prostate cancer treatment using robotic surgery gave a patient a risk of the complications, and they said, we have 1 minute left, so I can't talk about it, but I should hope that this man gets good success and good information.
Let me leave my number for...
Okay, that's the number, and we're going to be heading off to the wild blue yonder here.
Okay, 917-836-8105.
Okay, once more. Give it to us once more.
917-836-8105. And I thank you because you are putting me through the Spanish community.
All right, thank you.
Help them and to use your experience.
Thank you, and God bless you. And to all the listeners, stay warm, stay inside.
Stay safe.
But come over to our house and help Chavo.
Yeah.
If you have questions during the week, call us at 212-CHOICES. 212-CHOICES. We have a free booklet and DVD, and we're happy to answer your questions pretty much day or night. So, again, it's Dr. Lederman wishing you all well, and God bless you.
Have a great weekend, Doctor.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212